began my career in nursing in labor and delivery, and I witnessed firsthand as a labor nurse the chasm that we have been talking about, particularly the chasm between what we know and what we do in our clinical care and community care of the women for whom we care. And so when I decided to pursue a PhD in nursing and it became time to really start honing down on what those poignant research questions were that I had, I knew that I wanted to answer questions in this realm of how can we bridge that divide? How can we take better care of women, particularly in this area of postpartum risk reduction for cardiometabolic diseases, things like diabetes and heart disease. And through several turns, I think, that were pretty serendipitous, I was able to conduct my dissertation research in a large tribal community health system in the Southern Plains. And the reason I'm here today is because of the work that started then and the work that has continued since then with these same community partners and now other tribal community partners as well. But I remember one of the first interviews, so as part of my dissertation work, I was conducting interviews with women who had had gestational diabetes in the prior 3 to 5 years. And some of them even brought their little ones with them to the study session, which consisted of filling out some surveys and then doing an interview with me. But I remember one lady came in and she was by herself, and I think she had a 3-year-old or a preschooler at home. And I remember at first she was a little shy. She'd never been a research participant, and honestly, I'd never been a researcher. So we were both in new ground, and I think we both kind of understood that. But I remember starting to just ask her the questions that I knew were part of my script, and I was asking her questions about what it was like to have the gestational diabetes diagnosis during her pregnancy, and how really that had shaped the way she thought about her risk for developing diabetes in the future or heart disease. And I tried to ask it in an open-ended way so as not to lead her, of course, down any certain path of answer. And I remember she stopped and kind of looked at me and smiled and said, "No one's ever asked me those sorts of questions. And so I need to think about that." And so we just sat for a while and she thought, and then we had what I think was a meaningful conversation for both of us. And it was really that moment that I realized, and maybe later, maybe not in that exact moment, but upon reflection, I realized that I had set out to design interventions to help women reduce their risk after pregnancy. And in fact, that is still very much the work I do 10 years later. But I realized that in that moment, listening was an intervention in itself and was very much worth taking the time to do. And that's why I'm here today, and that's the message I want to leave with you, which is to find a way to hear voices and then to honor and respect what we're hearing and use that in our solutions and do this, just as Tamoria said, hand in hand in a partnered way. To me, that's what keeps me doing the work I do. That's what makes it worthwhile. Thank you.